My experience with the SPARSH Hospital has been good. We have gone through treatments. At first we started with the tests of sickle cell anemia and how we were supposed to go through it. We went through it, which was successful. The transplant was planned. We went through it, and the experience has just been wonderful. But I thank God for the doctors, for the SPARSH Hospital, that they managed to bring all that down, and it went on well. We went through the transplant, which of course was a bit challenging, but I praise the doctors and God who stood with us through that journey. And my son did very well during the transplant. The experience, of course, was as usual, going through the transformation after the transplant. But I thank the doctors, the nurses. They did a wonderful job. And I just give God the glory. But God is good. We are doing good. My son is responding well to the treatments. We are continuing with the medicine. And so far, so good.
I was born with sickle cell anemia. I had a challenge with it through my whole life. It was very difficult for me, but last year, God willing, last year a chance came and was given an opportunity to come to India and receive my treatment. We came with my mother and my sister as the donor. We came to a hospital, SPARSH Hospital, in India. At first it was very difficult. Before you get to know people, it was difficult. But when we came here, the doctor explained to us how the transplant would go through. He talks to us every step that will go through, what will happen, and all the challenges that may occur. We did all that, and after the test has been done, everything had been planned, we went in for the transplant. By God's grace, it was good. It was still challenging. There were some challenges, but the doctor responded well. They have a very good, capable team of nurses who are always there, ready to assist you when you want them. Everything was great, and after about 1.5 months, I was discharged by God's grace. Now I'm still receiving medication after the transplant, and we are hoping things will continue going well so that we can go back to our country. I want to thank Dr. Sunil, Dr. Mahesh, Dr. Punima, and all the doctors who are with them for helping us through this tough challenge.
Sickle cell disease is a genetic disorder, and mainly in this there is a change in the RBC shape, and that lead to the complications and mainly affecting major organs, mainly the brain, joints, and patient usually suffer with the severe pains and they have a very miserable life. So it is a major health concern in India and other countries in the world, and it is very severe in countries like Africa and sub-Saharan countries. And we got this Methuselah, the patient suffering from sickle cell crisis. He is having frequent sickle cell crisis, and that is affecting his quality of life, and it is life-threatening complication. So when he comes to us, we evaluated whether there is a match donor is available or not. We done the HLA typing, and unfortunately he doesn't have any match family donor. So we have only option, the sister was half match for the patient, and after counseling the patient, we decided that we will go ahead with the haploidentical transplant. So doing a haploidentical transplant in sickle cell disease is definitely a challenging part, because there is a more risk of rejection when we give the half match stem cell to the patient. And it is almost 1.5 months post transplantation. He tolerated the procedure well. He didn't develop any major complication, and he's almost cured of this sickle cell disease. So once the patient is successfully cured with the sickle cell disease, the patient will have a normal life ahead. So that is the reason it is one of the good opportunity for patients with sickle cell disease who are suffering from these frequent crises or complication related to the sickle cell anemia, who are not responding to the usual treatment like hydroxyurea, and who doesn't have any matched family donor. Haploidentical transplant is way to go.